Hello everyone, this is MBBS Gallery and today we are going to learn about an important topic, drugs classification, that is actually antithyroid drugs. So here I have written five types of drugs that are going to be act against the thyroid gland. There are hyperthyroidism conditions. So first of all, the thioamides and Lugol's iodines, and second, third is the potassium perchlorate, thiocyanate, fluoborates, radioactive therapy, and these are all also important one, the beta blockers, amiodarons, PTU, that is propyl thiouracil, and dexamethasones and ipodate. These are all responsible for antithyroid activity. In this, let us see a quick recap about the mechanism of action actually here. The thioamides. As we already come across the synthesis of thyroid hormone, right? So this thyroid hormones going to inhibit the thyroid hormone synthesis at any steps, as it has four more steps like oxidation, organizations, coupling, and release. So in this, the synthesis is going to be inhibited by this. So this is why first. Synthesis is going to be inhibited first once, and Lugol's iodide. Lugol's iodide is going to be inhibit the release of T3 and T4. So it's going to inhibit the release T3 and T4. And the potassium perchlorate, thiocyanates, fluoborates, these are going to inhibit the uptake of iodide ions. So uptake is inhibited. Uptake of iodide is inhibited, and the radioactive therapy is going to destroy the thyroid follicle, like in case of cancer or in thyrotoxicosis conditions, we are going to destroy the cells. But here we have to note an importance, thyroid follicles. So here we have to importantly note that this radioactive therapy, with the help of iodine 131, we are going to destroy the follicular cells, not the medullary cells. So it can be accessible to only a follicular carcinoma of the thyroid. And beta blockers and amiodarons, propyl thiouracils, dexamethasones, methasones, and ipodides. These are all going to inhibit an important enzyme known as 5-D iodinase is going to be inhibited, because these 5-D iodinase enzyme is one of the most important enzymes responsible for the peripheral conversion of T4 to T3. So once we get inhibit this, we can't able to get this active compound T3, right? So this is the mechanism shortly. So let us see it a little more clear in upcoming. So the thioamides includes carbimazole, methimazoles, and propyl thiouracil. This propyl thiouracil plays a different role and has a slight different from other group of compounds, so other group of drugs. So it includes carbimazole, methimazole, propyl thiouracil. Then already we see that the mechanism of action for thioamides is about inhibition of the formation of new thyroid hormones. So, and here is the another different thing here, the lag period is 1 to 3 weeks. What does this mean actually? Usually the thyroid and secretion or synthesis, after completion of the processes of like oxidation, organizations, and coupling processes, it tends to form T3 and T4, and that tend to be stored for about 3 weeks in the follicles itself, and then it gets released into the peripheral vascular system. So then it converted into T4, then converted into T3, likewise. So 3 weeks it about to be stored. So this is the lag period. This drug going to be take 1 to 3 weeks. And propyl thiouracils. What about the special about the propyl thiouracils? Actually, along with the inhibition of synthesis of thyroid hormone, it also inhibits the peripheral conversion of T4 to T3. All other drugs didn't have this property at all, but this propyl thiouracil have inhibition of peripheral conversion of T4 to T3. And the ADR commonly include most common adverse drug effects here by the thioamides are maculopapular rashes. So maculopapular rashes is the most common one, and when we are taking the methimazole, we can come across ADR of agranulocytosis, so increase in the granulocytic counts. And if we have to discuss an important about if you are discussing any drugs, we have to think about the pregnant women. So here, if thioamides is taken by the pregnant women, it contains a teratogenic property which causes aplastic cutis. What does that mean, aplastic cutis? It is actually nothing but a deformities of a scalp bone in the infants or children, newborns. The choanal atresia, which means a deformities in the nasopharynx development. This can be caused by the teratogenic effect of the thioamides. And if suppose in unavoidable situations, we can able to use propylthiouracil in the first trimesters. It is made to be slightly safe because this can be safe because due to it has high plasma binding property which present in this drug. It does not tend to cross the placenta to reach the fetus, and it it can cause a severe hepatitis. And also methimazole. Methimazole is a drug which can be safe in second trimesters. This is all about thioamides. Let us say about the Lugol's iodide. So Lugol's iodide. Lugol's iodide is nothing but the combination of 5% of iodide and 10% of potassium iodides. This is called Lugol's iodines. So what is the mechanism of action here? Here it inhibits the release of T3 and T4. The T3 and T4 is already found in the follicles, but its release is inhibited by the Lugol iodines. So we can able to describe this as a constipation because the already formed hormones are get stuck in the follicle itself, so we can able to refer it as a thyroid constipations. So this is one of the keyword. And what are the uses where we are going to use this Lugol's iodine? For what purpose we are going to use this Lugol's iodine? First of all, there is a fast acting drug, and thyrotoxic crisis we can able to use in along with the PTU in pre-operative preparation and reducing vascularitis. For what reason we are using this in preoperative preparations? Because it makes the gland firm and soft and less bleeding during the surgeries. And what about the ADR? This is actually angioedema, iodescence, and acneiform rashes. So let us remember by Alia. So Alia, here is this for Lugol's iodine. Sorry. First Alia. Let us remember by Alia. So L for Lugol, and A for angioedema, I for iodescence, and acneiform rashes. Next, let us say about the potassium perchlorate, thiocyanate, and fluoborates. These are also antithyroid drugs. Actually, one of the important ADR which is caused by the thiocyanate is psychosis. Psychosis will occur, and then mechanism of action is by inhibiting the uptake of iodide, and ADR is aplastic anemia and gastric ulcer. This is the most important, aplastic anemia and gastric ulcers. And one of the thing I have to mention here is that when we are if suppose a person having an hypertension, he was taking a drug of sodium nitroprusside. So sodium nitroprusside. So we already know that in sodium nitroprusside we have a cyanide group. These cyanide group tend to form a thiocyanate, which causes hypothyroidism. So here we have an interesting one is that one who taking a sodium nitroprusside drug for their hypertensions may develop hypothyroidism as their ADR because due to the formation of thiocyanate. So now we are going to see about the radioactive therapy towards the thyroid gland. So what is the element we are going to use in this procedure was iodine 131. So this is a radioactive iodine, so which has a T half of 8 days. This iodine has iodine 131 has two rays. One is gamma ray and the beta ray. This gamma rays has a special property and beta rays has a special property. So which both of them have a penetrating power of about 0.5 to 2 millimeter. And what are all the uses here? Actually, these beta rays have a specific use of acting towards the hypothyroidism in especially older and heart diseased patients, and it also can be focused on thyroid cancer, particularly follicular carcinoma, not in the medullary carcinoma, because this thyroid gets accumulated in the follicles only, so it can able to destroy the thyroid follicle carcinomas only. And this gamma rays is actually used in diagnostic scanning, like taking CT scan, like the procedures. And what about the ADS, that is adverse drug effect? This is first of all is in a hypothyroidic procedure, like hypothyroidism, right? So first ADS is going to be hypothyroidism, and it create breast cancer, and it is a radiation procedure, so it will create a radiation thyroiditis also. It is taken to be cause. And contraindication, what is the contraindication which is present? Pregnancy. We can't able to use this in case of pregnant women and children, young children, and ophthalmopathy, which is most important here. Okay, this is all about the radioactive therapy. Finally, we have the fifth one, that is beta blockers, amiodarons, and propyl thiouracils, and dexamethasones and epodoid. These are going to benefits, as we already know that an important enzyme called 5-D iodinase enzymes, which is responsible for the conversion of peripheral T4 and T4 into T3. So this gets inhibited by this compounds. Okay, I hope that this video helped you a lot to remember a few things about the antithyroid drugs. This will help you even in a competitive examinations like NEET PG, and support us for more videos. Thank you for your patient listening. Thank you.